very prone to develop some inflammation, and there is, as such, there is no test to establish the actual cause for this chronic inflammation. So there is no such theory at present for modern pathology. There is no such explanation for the cause for this chronic inflammation, but they had also produce some autoimmune disease. Next, the classification. Autoimmune disease we can divide into mainly into two: one systemic and organ specific autoimmune disease. These are the common systemic autoimmune disease: celiac disease, lupus, Sjogren's syndrome, scleroderma, rheumatoid arthritis, vasculitis, dermatosis. And systemic disease, the condition tend to be associated with autoantibodies antigen that is not tissue specific. It's not tissue specific. If it's tissue specific, it's local. The local condition autoimmune diseases are endocrine diabetes mellitus, Hashimoto's, Addison's disease, pernicious anemia, pemphigus, vitiligo. These all are the local. We can have specific antigen. And hematologic and neurological condition, even autoimmune encephalitis, myasthenia gravis, multiple sclerosis, all are local syndromes of autoimmune disease. Then what are the, as a doctor, we should know what are the treatment in the contemporary system, what are the treatment available. Mainly in modern system, they are treating by giving some immunosuppressive, anti-inflammatory or palliative treatment. These are their mode of management. Some immune suppressive, anti-inflammatory and palliative treatment. Then non-immunological therapies, hormone replacement, for example Hashimoto's thyroiditis, type 1 diabetes mellitus. They treat the outcome of the autoaggressive. These are only a palliative treatment. They are also only palliative. They are supplementing by giving this thyroid supplement or some diabetic or something. That's the treatment. Then most interesting is this dietary treatment. Celiac disease, they are also supporting for some dietary treatment. Then steroid or non-steroid anti-inflammatory drugs are limit the inflammatory symptoms many of the disease. And IV immunoglobulins have some role in Guillain-Barré syndrome and chronic. Then some treatment and approach. Most interesting, I want to show you this slide about the new treatment trend in modern medicine. They are one of experimental approach. They are helmintic therapy. They are ingesting inoculation of either nectar, amaranthus, or commonly known as hookworm, or commonly known as pigworm eggs into human body, human stomach. But they are suggesting that by implanting or by ingesting these inoculating these helminths, that's divert the immune mechanism that concentrating on this pigworm and this hookworm, that's reduce the course of severity of the autoimmune disease. They are claiming they are very scientific, but this is one of the method. Many of them claiming homeopathy is not scientific, but this is their experimental method to reduce the aggressiveness of the this autoimmune disease by inoculating either this worm into the human body, thus divert the manifestation of the direction of the autoimmune, reduce the severity. That also helps to reduce the severity of the condition. This one method. Then the treatment options. What are the other treatment options other than the immunosuppressive or anti-inflammatory drug? But they are suggesting. One is vitamin D supplement. Because vitamin D is almost receptors are on in all cells, including B cells and beta cells and B and T lymphocytes. So if you are giving vitamin D supplement, that reduces the severity of the autoimmune disease. The research. Vitamin D plays a role in immune function by acting on the T cells and natural kill cells. That if you are giving the proper amount of vitamin D, that reduces the severity of the autoimmune disease. Next, but some conditions, for example lupus, patients are advised to avoid sunlight. That may be a reason their vitamin D is less. That also leads to a severe condition of the autoimmune response for that patients. Then omega-3 fatty acid, that also. Studies showed that adequate consumption of omega-3 fatty acid counteract the effect of some arachidonic acid that contributes symptoms of autoimmune disease. Actually, to study the biochemistry, then we can understand these acids having some role on the normal immune mechanism and on memory. So, if you can give omega fatty acid, that also gives some effect on to reduce the severity of the autoimmune disease. One is vitamin D and second is omega-3 fatty acid. Then probiotics. Some lactobacillus have shown that some effect to stimulate immune response in tumor mice and regulate immune function, delaying or preventing onset of non-obese diabetes. Type 1 diabetes have some role. If you are taking lactobacillus, that can also reduce the severity or can prevent or delay the complication by taking lactobacillus. Next is antioxidants. There is no such supportive documents. That there was a study that theorized that radicals of onset of type 1 diabetes in young children, their risk could be reduced by taking intake of antioxidant substance during pregnancy. But that study was not proved. So there is no scientific evidence that taking some antioxidant that can prevent or delay the onset or can reduce the complication of autoimmune disease. Someone is claiming, but there is no scientific support for these antioxidants. Next, my topics is Crohn's disease. Crohn's disease, I treated on case. Before going to that case, I try to give some information on what is Crohn's disease. It's also an autoimmune disease. Then Crohn's disease is inflammatory bowel disease that causes chronic inflammation of the GI tract, which extends from stomach to all the way down your anus. Different areas of the gastrointestinal tract can be affected in different people and often spreads into deeper layer of the bowel. That's the most important. This is the latest in the ICD classification. Then other than the generic symptom of autoimmune disease, this is also a autoimmune disease. These are the specific symptoms. In homeopathy view, these are specific. Generic and specific symptoms of Crohn's disease. The common symptoms or generic symptoms of autoimmune disease we are already discussed, that fatigue, fever, there are many other 8-9 symptoms. Other than the specific symptom, these are the specific symptoms for Crohn's disease, that are abdominal pain, blood in stool, nausea and vomiting, diarrhea lasting more than 2 weeks, unexplained weight loss, fever in addition to any of the above symptoms. These are the specific symptoms. Other than that, gastrointestinal symptom, inflammation of skin, joints, and inflammation of the liver and bile duct. Some may develop kidney stones and iron deficiency because it commonly affects the ileum, and iron deficiency and delayed growth or sexual development in children. Usually the age of onset of this condition was 13 to 14. That's why we can find that some delayed sexual development in children that are observed in Crohn's disease. These are the common sites where you can see eye symptoms, kidney symptoms, skin, circulation, joints, biliary tract, liver, mouth. We are already explained. These are the common area where you can experience. I showed a picture of female. Is common in females. Almost all autoimmune diseases are common in female, and there are many explanations for that. Mainly that's because of a large number of active hormones during the fertile period. Then the pathophysiology, Crohn's disease begins with crypts, inflammation, abscess, which progress tiny focal aploid ulcers. The mucosal lesion develop deep longitudinal and transverse ulcers. In your pathological study, after removing the parts from the intestine during surgical correction, when most of this Crohn's disease was a part of the treatment, because it produces some stricture and constipation, and this fistula is very common Crohn's disease, and usually the biopsy study they are taking any part of the intestine or in a part, we can find the deep longitudinal or transverse ulcers with mucosal edema and couple stone appearance of the body. That's a common feature. The pathophysiology is multifactorial, involving same genetic predisposition, infection, immunological, environmental and dietary factors. Most frequently involve the terminal ileum and right cord. These are the commonest site where you can see the Crohn's disease manifestation. The initial lesion starts out infiltrate around the skin, goes deep into ulceration, first in the superficial mucosa and towards deeper layers. As the inflammation progresses, non-penetrating granuloma from involving all layers of intestinal wall. It can develop into classic cobblestone mucosal appearance and skin lesion along the length of intestine, sparing areas with normal mucosa. Usually the scarring is very common, so that leads to stricture and constipation very common, and constant pain abdomen. These are common. Granuloma formation is very common in Crohn's disease, but their absence does not exclude the diagnosis. The scarring leads to bowel obstruction and stricture formation. The scarring leads to bowel obstruction and stricture formation. There is associated endovesical, endocentral and endocutaneous and endovaginal fistula. Anywhere, especially perineal fistula is very common. Around anus and all perineal areas common with fistulas opening. And there is also very offensive discharge and very painful discharge and is mixed with blood, very common. Immune-mediated response in Crohn's disease involves both innate and acquired mechanism by macrophages, neutrophils, T cells in the intestine, which promote pro-inflammatory mediators like tumor necrosis factor alpha. Colonic Crohn's disease were found having high levels of cytokine like interferon gamma, interleukin 2, I2 and 18. Crohn's disease is primarily regulated by T helper cells T1 and 17 mediated process. Intestinal endoscopy. This is the most accurate method as for diagnosis. Modern medicine is considered this is the most accurate. That's endoscopy, study of the intestine. We can rule out other ulcerative colitis and diverticular disease or cancer. For performing intestinal endoscopy, we can confirm this. This is the simple way to diagnose a case of Crohn's disease. First, the fecal cal protecting testing. Actually, simple stool test. We take the stool of the patient for cal protecting. It's a protein. Actually, if there is inflammation, then there is a rush of macrophages to the side, and that leads to severe inflammation, and that's the excessive production of protein. That protein is present in your stool. That by identifying this cal protein protecting is positive, then you go for the proper test of Crohn's disease. Then toxic presentation, there is the toxic megacolon is very common in Crohn's disease. Then you go for the toxic presentation, that's toxic megacolon, the swelling, sudden swelling of the abdomen with severe symptoms of septicemia. Then you can by CT examination you can diagnose this. Otherwise, then non-toxic presentation, ileocecal colonoscopy with biopsy and the test. Simple test is very simple to find. A cal protectin is positive, your CRP is raised, your ESR is raised, then we can confirm it's a case of Crohn's disease. Then go for endoscopy. First of all, stool examination, simple blood test examination by seeing the CBC, ESR, then this CRP and raised ESR, we can confirm it's a case of maybe a case of Crohn's disease, and by performing endoscopy one can diagnose this pure case of Crohn's disease. And the site of affection of Crohn's disease also be confirmed by this endoscopic examination. This fecal calprotectin is a very sensitive marker for inflammation of gastrointestinal tract and useful for differentiation of inflammatory bowel disease from irritable bowel syndrome. In irritable bowel syndrome it is negative, and inflammatory bowel disease it is positive. Biochemical measurement of the protein calprotectin in stool. Elevated fecal is indicating migration. Then first test will be the blood and stool, then X-ray upper and lower GAT. C-reactive protein levels very raised in both the groups where significantly higher Crohn's disease than ulcerative colitis. It is very high in Crohn's disease than ulcerative colitis. then CRP, then calprotectin, and there are the markers for inflammation level. Then colonoscopy, CT, MRI, these are the other tests. Then this is a guideline. This is Fund for and Gastrointestinal for Management of Crohn's Disease, American College of Gastroenterology. Some guidelines that published around 12 guidelines for diagnostic case of this Crohn's disease. Differential diagnosis. By simply seeing a blood in stool, we can't never go to this diagnosis of Crohn's disease, because it's simple normal common, it's not simple, common amoebiasis and Buzzard disease, celiac disease, intestinal carcinoid, intestinal tuberculosis, mesenteric ischemia, and ulcerative colitis also having same symptoms. So you have to roll out one by one. The main symptom is calprotectin and raised CRP and ESR, and confirmed endoscopy is the diagnosis for this condition. Then complication. The common complication already described, that is bowel obstruction. The Crohn's disease is bowel obstruction. And because there is a high chance of scar formation, that leads to a narrowing of intestinal tract, that leads to severe constipation and bowel obstruction and severe pain. And later there leads to some production of some fistulas. This ulcers. Chronic inflammation leads to open ulcers anywhere in your digestive tract, including mouth, anus, and genital area perineum. Anywhere you can see these ulcers. Then fistulas. These are anal fistula, and this is malnutrition. These are the complications. This colon cancer is another complication, and blood clots. Skin disorders, actually is very interesting. Hydatitis suppurativa is very common condition we are come across in our daily practice, in our normal practice. This is very common. This Crohn's disease patient have a chance to develop this hydatitis suppurativa. Someone have this condition, then there is a relation between this condition and the Crohn's disease. Very interesting. So if someone comes to us for treating this hydatitis suppurativa, you can and this also. Other. This is medication. Medication is very. If you are taking alloputex, that leads to complication more than the actual complication of disease. Another treatment option is surgical treatment, and then diet and manifestation. Then homeopathy management. I try to conclude my presentation. This is firstly my point. You have to, for taking any case of Crohn's disease, you have to give more emphasis on the generic symptom of the autoimmune disease. That is the fatigue, fever, muscle ache, joint pain, swelling, skin symptom, abdominal symptom. Then the specific symptoms of Crohn's disease. Whatever may be the condition, if it is Hashimoto's thyroiditis, you consider the specific symptoms Hashimoto's thyroiditis. If you are treating a rheumatoid arthritis, you consider the specific symptoms of rheumatoid arthritis. These are the specific symptoms of the Crohn's disease. Then the individual symptom. These are examples of individual symptoms, that is depending on the person. Aggravation of complaint, I think these are only examples. These are not these type of symptoms which help us for finding the similarity for homeopathy doctor. For us, this is most important. If you have an understanding about the general symptom, the specific symptoms of the disease, and then the individual is a prime. If you have an individual symptom of the patient, that these three, generic, specific, and individual, that leads to your totality symptom that will give you a symptom. This is a case of one case. I treated the case. He was a 14-year child, is admitted in one of the famous hospitals in Kerala during COVID time. Actually, the consultation mainly through online consultation there. Actually, he knows me for a long time, his parents. So they consulted me. It's a pure diagnosed case of Crohn's disease, and they drained the perineal abscess many times, a very severe condition, and his CRP was very raised, ESR was very raised, and endoscopy was positive, and all other granulums positive, anti-nuclear antibody was positive, all the tests were positive, and they shifted him from that Aster Medicity, one of the famous hospital in Kerala. Then they shifted to one of the pioneer in gastroenterology surgery, Dr. Philippa in Kerala, one of the famous doctor. They consulted him. He is a very eminent person for treating this type of case. He diagnosed the case of this Crohn's disease, and you can see the values of the CRP and the norm blood's hemoglobin, reduced hemoglobin, all other parameters were reduced. And they did the endoscopy. Endoscopy study, you can see the presentation, and they're diagnosing Crohn's disease case. They diagnose, then they take the sample from the ileum and they send for the biopsy study. Biopsy study again confirmed it's a severe case of Crohn's disease, and they started surgical part of the report. You can see one by one. I share the document. I will share the document. And their treatment mainly was giving some steroids, Viscon 5 grams 7 days, and almost for the 2-3 months they are treating with saline medicine, but there was no improvement. The condition of the child was very serious. His weight comes down from 670 to 47 kg. He can't eat, SCV, and all his blood parameters comes down. And he also developed severe fear during the disease condition. He was, especially the complaints aggravate during night, and he can't sleep alone. He was crying. He was so hopeless about the progress of the condition. There was severe pain. Actually, almost all cranial area is having multiple fistulas, which is blood and mucus comes through that pain, and very offensive. And he can't sleep. He can't go to school. He left the school for that COVID time. Again, he can't do any other activity because of this severe pain and this severe condition. And his health was so weak, he can't even move. And they consulted for a homeopathic consult with me. I take the case, and based on the treatment, I prescribed the first medicine was luticum, 50 and 2 dose diya tha. Then I asked them to take calendula tincture for 6 parts regularly. After 1 month, I prescribe again, take the case again, review the case, and prescribe tuberculinum 2 dose, again calendula for 6 parts. Again follow up the case for then again tuberculinum 3 times I prescribed tuberculinum. Last I prescribed the medicine Carbovesh SOS. By the time of this tuberculinum, after second dose, complaint was almost cured. His weight gained. Now he is about 70 kg weight, and he is going to school regularly, and he had no other health issues. And again I asked to review the test. Now his CRP ESR comes to 5, and CRP again comes first time 2.25 tha. Now it comes latest reported. Now his CRP is only 0.48, and the ESR also less. And then I asked them to perform another anti-nuclear antibody test. That is a very confirmative test. Actually here you can see the ESR is 15 now, and the CRP is 0.40. And this I asked them to perform an anti-nuclear antibody test. They performed yesterday, and they sent the report yesterday only, and the anti-nuclear antibody is also negative. This is a case of this is cured, 100% cured by homeopathic medicine, and now he's okay. Okay, thank you, sir.
Thank you so much, sir, for your such an informative and enlightening information in the presentation. Now I would like to call upon Dr. Manish Bhatia sir and Dr. Pankaj Agarwal sir to please chair the next session. The speaker for the next lecture is Dr. Anil Nair sir. Sir, please come on the stage. The CMO Government of Delhi. Sir has an clinical experience of over 20 years with OPD of innumerable patients in Dr. B.R. Sur College and Hospital, and he is also the co-author of the book Crack the Entrance. Kindly welcome the sir with a great round of applause.
सुनो। हाँ भाई, साहिल का नंबर।
Good morning, everybody. Good morning, respected
Hello,
dignitaries and my dear friends. Many of the faces are known to me, and it is really a honor and privilege to be here among you people to present my few cases. You know, maybe this is an era of autoimmune diseases. Plenty of autoimmune diseases are reported, and homeopathy, I think, a relatively good scope in treating in autoimmune disease also. Because maybe till 70s, infectious diseases were the main challenge faced by humanity, and to an extent, infectious diseases were managed. Obviously, there are new type of diseases are emerging. That is a different issue. And later on, in 80s and 90s, we were struggling with lifestyle diseases. Now there is an addition within the last 1 or 2 decades, because of already Dr. Amar Bodhi has discussed in detail regarding what is autoimmune disease. Maybe pollution, stress, dietary habits, these are the things attributed to the high rise in autoimmune diseases. The problem with autoimmune diseases, like there are many relatively harmless conditions like Hashimoto's thyroiditis too,
उसी को
and
कंटिन्यू करा
this
हुआ
is
है।
discussed here, already discussed.